Hello, I am Dr. Veerendra Koujalagi. I am medical gastroenterologist practicing in Sahakar Nagar, Bengaluru at my clinic Eka Gastro and Liver Care. Colon cancer is a very dreaded disease which affects many people in our society. So, in fact, India is less stricken with colon cancer compared to the West. It is because of our dietary habits and also our lifestyle. But with most westernization of our diet and westernization of our lifestyle, the severity and the prevalence of colon cancer is been growing. So, what are the risk factors that are there? One, definitely there is family history. So, somebody, your first degree relative, that is your parents or their siblings or your cousins who have colon cancer, then it is important that you be aware of colon cancer risk and get screened for it. And also anybody who is above the age of 40, and especially in men, there is higher risk of colon cancer. What are the other lifestyle changes that I was talking about? One, obesity and intake of red meat and chronic constipation and sedentary lifestyle, all of them contribute to presence of colon cancer. So, how do we avoid it? Avoid red meat as much as possible. Take more fresh leafy vegetables. Take more colorful diet. Take that is with fresh fruits and vegetables. Take more fiber in the diet so that your bowel movements are fast and there is no chronic constipation. So, all of this help in preventing colon cancer, as well as be physically active, maintain ideal weight, so that can prevent occurrence of colon cancer. How to screen for it? So, the screening test for colon cancer ideally should be a colonoscopy. It is not necessary to do it routinely. So, once it is done as an index colonoscopy at around your 40 years of age, then we can determine your risk factors. So, if there are already polyps there, what are the kind of polyps and how many polyps, and the family history. Based on that, we can plan in how many years you would require a repeat colonoscopy for screening. The advantage of colonoscopy in screening is that it will directly examine the mucosa, inner lining, and will pick up any problems, and at the same time, if there are polyps, they can be removed, which will abort any further occurrence of colon cancer. There are other methods like usage of look for blood in the stools. There are stool tests to see that, but they are not ideal, but they are acceptable but not ideal. So, if somebody cannot undergo colonoscopy, can undergo tests in the stool which look for blood in the stools. But the advantage of colonoscopy is that even before this stage arrives, it can pick up and abort future colon cancers as well.